concentration, if I want to compare the concentration of T4 with T3, actually amount of thyroid hormone production and release T4 is approximately 95% and T3 is 5. Okay, if you compare the concentration, only 5% is related to the T3, but the biologic active actually of the thyroid hormone is a T3. Okay, this is the T4 as a reserve here again. Okay, when it became deiodination, it converted to the T3. So whenever our body requires to the function of thyroid hormone, T4 considered as a reserve here. Okay, T4 undergo a chemical reaction by the 5' monodeiodinase. It means that the iodine atom actually liberate from the T4 and convert to the T3, and now this T4 after converting to the T3 now is active. The name of enzyme is important. Physiologic effect of the thyroid hormones. Actually, any aspect of the metabolism can affected by this hormone. For example, cardiovascular system, lipid metabolism, carbohydrate metabolism, I don't know, fertility, controlling appetite, controlling the sleep cycle. Actually, because these hormones are very, very important. So if you have any problem regarding to this system, for example, cardiovascular system, for example, maybe you have a high blood glucose, okay? Maybe it is not related to the diabetes. Maybe you have alteration in the production of thyroid hormone, and this is as a result of the alteration of thyroid hormone. So you should treat the thyroid gland, okay? It is not necessary to take insulin, or take a metformin as a drug, okay? Or sometimes your patient has a high cholesterol, okay? Maybe you prescribe them a statin to control the, for example, the cholesterol, okay? But if you at first actually order the T3 or T4 and also other hormone that's related, for example, TSH, this is a hormone that's related to the function of thyroid gland. If you order the measurements of activity or concentration of this hormone, you find that, okay, this alteration or this high cholesterol is as a result of hypothyroidism, okay? So you should know that all actually system or all metabolic pathway can affected by the thyroid hormone. So it's better to consider the thyroid hormone as a routine checkup, okay? So because it can affect any part of the body. So as I mentioned, they can stimulate diverse metabolic activity, and it can increase the basal metabolic rate. Okay, for example, it can increase the body heat production, and also they can increase the hydrolysis of ATP. About lipid metabolism, actually the increased amount of the thyroid hormone can stimulate the fat mobilization, and actually they can increase the fatty acid oxidation. And for example, as I mentioned, regarding to the hypothyroidism, when we say hypothyroidism, what does it mean? Hypothyroidism.
Yes, the thyroid release.
It means that if you measure the concentration of the T3 hormones, okay, it is lower than normal range, okay? This situation known as a hypothyroidism. In this situation, if you evaluate the cholesterol, it is not related to the cardiovascular disease. It is as a result of the hypothyroidism. And about the carbohydrate, actually, all aspects of the carbohydrate metabolism can affect by these hormones. For example, this hormone can induce the uptake of the glucose by the cells, increase the gluconeogenesis, glycogenolysis, and all of them result in a free glucose. So, as you can see here, thyroid hormone can result in an increased concentration of glucose. So, whenever, at first we didn't check the T3 hormone, okay, the function of thyroid gland. but your patient had, for example, 120 milligram per deciliter of FPS, fasting blood sugar. Maybe we suspected to the diabetes. No. At first, before starting the treatment for the diabetes, at first please order the function of the thyroid. If the function of thyroid is normal, okay, so you should follow, for example, there's some symptoms regarding to the diabetes, okay? So it's better beside, for example, FPS, cholesterol, or lipid profile, it's better to order the function of the thyroid as a T3 or TSH. And another function of this hormone, they can control the growth, and they are necessary for to the normal growth, especially in naturally growing children. Okay, these are very, very important. And also, it is very important for the development, especially during the fetal and neonatal, for the neonatal brain. And it can affect the cardiovascular system. It can increase the heart rate. You know, you have a patient who has a hypothyroidism, or maybe you have a patient who has a hyperthyroidism. In case of hyperthyroidism, your patient, okay, his or her thyroid gland produces a large amount of thyroid hormone, okay? When you have a large concentration of thyroid hormone, you have a tachycardia, okay? Tachycardia is actually increase in the heart rate. And for example, if your patient have a hypothyroidism, it means that you have a low concentration, so your patient have a bradycardia, okay? And they can increase the rate of breathing, okay, like this. Okay, when a patient who have a severe hyperthyroidism, actually they have a high rate of breathing, and also about the body temperature. Okay, a patient who has a hyperthyroidism, if you touch her or his hand, all of the time is very warm. Okay, because one of the effects of the you are normal. Okay, this summer. But normally, for example, in winter, okay, they have a high body temperature. Maybe at first, maybe as a result of some infection, okay? But if there is no infection, normally they have a high body temperature as a result of hyperthyroidism. Now, other effects, for example, they have this hormone can increase the appetite. And also, please pay attention, thyroid hormone can affect the gut motility. And there is a direct relation between the gut motility and thyroid hormone. I want to ask you a question. In the case of hypothyroidism, there is a diarrhea or constipation in a hypothyroidism. We have a low constipation, okay? Because the gut motility is low, okay? But in a case of high concentration of T3, they have a diarrhea, okay? Because they have a high motility of the gut. And now the central nervous system, for example, they can increase the, they have actually effect on the mental state. For example, they can control the sleep cycles, and they can affect, for example, your mood, anxiety, or nervous health. And also, some actually women have a problem regarding to the menstrual cycle. Okay, it means that some women have an irregular menstrual cycle. One of the tests that women should control, it is a thyroid. Okay. This is a thyroid actually test, okay? Because sometimes this is as a result of the alteration and concentration of the thyroid hormone. And in some case of infertility, hypothyroidism known as the origin of the infertility. Because again, thyroid hormone can affect the reproductive system. So, as you can see here, it is very, very important. As a routine test, you control the concentration of the thyroid hormone and the function of the thyroid gland. I want to continue with some disorder regarding to the thyroid gland. As you know, again, hypothyroidism, it is a condition as a result of deficiency of hormone. For example, sometimes we have a autoimmune disease, inflammatory disease. Okay, during this process, our gland actually became damaged. Okay, so our gland cannot produce the appropriate amount of this hormone, so it can cause a hypothyroidism. About the common symptoms is a lethargy, fatigue, cold intolerance, weakness, hair loss, and also reproductive failure. All of these symptoms are regarded as a hypothyroidism. The symptoms is very, very important. If you have an untreated hypothyroidism, especially during the pregnancy, this condition known as a cretinism. Okay? Cretinism, if I ask you, is it hypothyroidism or hyperthyroidism at first?
Hyper.
It is a hypo,
Hypo.
and also, especially if it happens during the pregnancy, it can lead to the delay in the growth of the fetus. Okay? So, as I mentioned, thyroid hormones are especially important for the growth and also development. So, when you have a lack of thyroid hormone, especially during the pregnancy, so your fetus actually cannot grow appropriately. And this situation known as a cretinism. And sometimes too little iodine in the diet, okay? Because many years ago, most of the actually food, the source of the iodine was very low. Nowadays, especially in Iran, they enrich the salt with the iodine, okay? Because many years ago, we have a very rate and prevalence of the hypothyroidism. So the government actually decided to supply the iodine and add the actually iodine and enrich the salt with the iodine, because too little iodine in the diet is the most common cause of hypothyroidism. And in the country, they have enough. And in this condition, if you actually take a low amount of the iodine in your diet, maybe you encounter with the condition is a Hashimoto thyroid, actually inflammation of the thyroid gland. And it is an autoimmune condition sometimes.
Hashimoto.
And the most cause of actually hyperthyroidism is the Hashimoto. So you should know that, for example, cretinism and Hashimoto are related to the hypothyroidism. These are examples of the MCQ test for final exam. And most of the case can be controlled and treated by the oral administration of the thyroid hormone. This is not actually fatal. If you understand there is a problem, you can start the treatment and you can control all these symptoms. About the goiter, actually constant stimulation of the thyroid gland and to release more hormones. For example, the concentration of the hormone in our body is very low. Okay, so our body from the brain send a signal to the thyroid gland. Okay, and they stimulate the thyroid gland to produce more and more. Okay, as a result of this stimulation, the size of the thyroid gland became large. So this situation known as a goiter. Okay, hypothyroidism is one of the most common cause of goiter. Okay, this is the goiter. As I mentioned, for example, normally it is not actually visible in a normal patient. But in a goiter, because our body cannot produce the hormone, our brain sends some signal and some hormone to stimulate, and as a result of this stimulation, the size became larger, okay? So this is known as a goiter. Another pathological situation, this is a hyperthyroidism. As the name implies, the concentration is high, okay? And the most common form is a grapes. Okay, so maybe in one of them for MCQ test, I put the grapes, okay, and I asked about the hypothyroidism. Okay, grapes is not related to the hypo; it's related to the hyperthyroidism. What is grape disease? This is an immune disease which we have the autoantibodies. What does it mean, autoantibodies?
The inner immune system to be attacking the antigen, thinking that they are bad cells.
Exactly. sometimes our immune system recognize the natural antigen mistakenly, okay? By mistake, our immune system produce the antibodies, okay? And these antibodies can destroy our glands, our organs, our tissue, okay? So in this case, our body can produce the autoantibodies, and these antibodies can bind to the TSH hormone and actually leading to the stimulation of the hormone synthesis. The common sign is opposite of the actually hypothyroidism. Okay, for example, this include nervousness, insomnia. For example, most of the hyperthyroidism case are thin. Okay, and they have a hot hand. Okay, and they have a high heart rate. Okay, and actually hair face or actually his face is also because they produce a large amount of ATP and resulting the actually temperature, they produce a temperature all the time. They have a red face, okay, in a severe case, okay. These are simple actually symptoms of the hyperthyroidism. They have a high rate, heart and eye disease and anxiety. Graves' disease is commonly treated, and how we can treat and how we can control the symptoms by simply anti-thyroid drugs. Why? Because this is a hyper, we have a high concentration. So if you have some drugs that control the concentration of this hormone, like protein, urea, or methimazole, these are the drugs for control the Graves, because they can control and suppress the synthesis of the thyroid gland. Thyroid hormone. Another regulation, actually, as you can see here, we have three organs that are related together. We have a hypothalamus, inferior pituitary gland, and thyroid gland. For example, the production of this thyroid hormone is primarily regulated by TSH. Okay? So I want to mention a point. If you want to evaluate the function of the thyroid hormone and thyroid function, instead of T4 and T3, it's better to order the measurement of TSH, okay? Because in some cases, there is a problem regarding to the production of the hormone. If you measure the T3, maybe this problem is not detectable, okay? Even a small alteration in the function of the thyroid gland can change the concentration of TSH, okay? So TSH is the best marker to evaluate the function of the thyroid gland, okay? But, for example, T3 is suitable, but it is less sensitive than TSH, okay? So, whenever you want to evaluate the thyroid function, as the first step, you should order the TSH, okay? If it is normal, but you have a symptoms, you can order the other specific test for the thyroid gland. I don't know, free T4, free, for example, free T4, free T3, okay, total amount of all of them are regarded as a general test for the thyroid. What